Now we'll look at another deformity, which we'll get to make some sense out of it. And this is what is known as the Madelung deformity. Madelung deformity. Okay? So if you have Madelung, you feel like it's something that has to do with the lung. No, it's actually hand stuff. So it's a rare congenital wrist abnormality, and it's caused by what? Defective growth of the distal radius. See, they say that the radius does not grow properly, okay, forcing the ulna out of what position. Nice, isn't it? Okay, so it leads to a lot of issues. Okay, let's discuss. So it's bowing of the radial shaft with abnormal growth of the distal radius. It results into the wrist is not aligned properly, you know. So pathology, there's premature closure or defective development of the ulna and the volar portion of the distal radial growth plates. So in appearance, there's increased radial inclination, volar tilt of the distal radius, subluxation of the distal radio-ulnar joint, okay, then the ulnar carpal impaction, you know. So the ulna is pressing into the carpal bones, okay. Seeing how the hand having a Madelung deformity looks like. So it can be bilateral, you know. It can be on two sides, okay. It can be on one side. This is one side. So it's usually linked towards mutation in the gene known as the SHOX gene, you know. And you can see it associated with other syndromes like the Léri Weill, dyschondrosteosis, and the Turner syndrome. So other factors are those repetitive traumas and the rest of it. So clinical presentation is there's a lot of wrist pain, there's limited range of motion, there's visible deformity of the wrist, and the forearm is short. Okay. So you diagnose it using all those X-rays, MRI, CT scan. So management, sometimes you can just be observing if there's no issue. Sometimes use all those splintings, physiotherapy, then corrective osteotomies, then ulnar shortening osteotomy too. You can also use it.